Oh, you know what? Someone just gave me this card. Someone else just gave me this card. Oh, well, thank you. So, yes, we have doubly gotten this card now. Nope, we're good. Oh, more mics. Look at that. That needs to get put on. Where's the... well, you are loud. Let's get you a mic anyway. One for you. You guys just want to share the two mics? And we have that one. I think we're good. Because I have this. Okay, hi. We're going to start because we're running late. Yay. Welcome back. This next part of the day is about advocacy. It's about self-advocacy, advocacy for the greater community, as well as the importance of self-care. We have 3 panelists for us for our discussion. I'm going to introduce them in a minute. I haven't even said anything yet, and they're clapping. It's a good thing. And we're going to try to do this in a little bit more of an informal way and more of a conversation-y TED Talk. We were supposed to have a couch with some chairs. We don't have that. I might walk around a little bit. We will have time, hopefully. We'll see how it goes for some Q&A at the end. So again, if you have a question, write it on the card. And I'll walk around and get them and see what we can do. All right, so our panelists. Our first panelist is Juanico Mata. Juana's at the end. She has her name in front of her. Juana's a clinical social worker with the Department of Children and Family Services, and she's also a Lupus LA support group facilitator. And she's been part of the Lupus LA family for a really long time. I can also share that she is also a lupus patient. Next is Jessica Rochendale. I have to look at my card because everyone has a very specific title. Her title is a licensed master social worker, although they're all social workers. And she's also the author of this book. You want to hold it up? It's called Lupus 365, Tips for Living Well. She's the former director of social services for the SLE Lupus Foundation in New York. She is not a lupus patient, but she can talk about her own journey later. And last but not least is Liz Morasso. Liz is a licensed clinical social worker and works in the Department of Radiation Oncology for the UCLA healthcare system, and is also a lupus support group leader for many support groups, not just one, but for many, including our pediatric support group program. So welcome. Thank you so much for being here today. I think we should sort of get right down to it. You know, we spent some time talking with Catherine about different topics that would be relevant for us to talk about today. So I'm going to kind of guide us through. Again, if you think we missed something at the end, make sure you write the questions. And shall we? So, Juana, let's start with you. Why don't you tell us a little bit more about you other than what I shared? And if you could also share what does the term advocacy mean to you?
Okay.
Yeah, use the mic or speak really loud.
Good morning. My name is Juanico Mata. I was diagnosed with lupus in 2009. Since my diagnosis, I've had many complications, including low platelet count, mouth ulcers, rheumatoid arthritis, headaches, and the list just goes on and on. When I was diagnosed, I was very scared. I knew that there was no cure for lupus, so instead of shutting down, I just went ahead and started learning more about lupus. I did reached out to Lupus LA and started, my sister and I started a support group that we run in Baldwin Park. We have been doing this for 5 years. We facilitate for not only lupus patients, but for caregivers and family members. We like to just come together and learn from one another. In the support groups, we actually incorporate art therapy, meditation, and mindfulness. I do thank you for just allowing me to be here. And when I have problems or I struggle with lupus flares, my sisters and I actually came up with a slogan, and we go by it. It's never give in, never give up, never let go. We just have to keep on fighting. And what advocacy means to me, it's mean to be a voice not only for myself, but for lupus patients, lupus community as a whole, and to hopefully one day find a cure for lupus and make it easier for our future generations. I do this by sharing with other people. We've done proclamations in different cities, and we just like to be out there and let people know that, there is hope and that we're there also to help.
Thank you so much. I want to say that Juana co-facilitates the group with her sister Estella, who's not here with us today. She's at another conference. But the whole Mata family is this strong, amazing unit that show up for everything. They're super involved. They're really passionate about advocacy. So I'm super happy that you're here today. Next, Jessica, you want to tell a little about you and also maybe what advocacy means to you?
Sure. So thank you for having me. This is actually my first lupus event in Los Angeles. I come from New York. I moved here at the end of January. It'll be 2 years. So this is exciting for me to be working with Lupus LA. And I don't have lupus. I have fibro. And even though I was the one who was facilitating the support groups in New York, I started to listen or to hear people's stories and think, some of these symptoms sound a little bit too familiar, symptoms that I was dealing with for my whole life. And luckily, I knew like every rheumatologist in New York City, so I just picked one and went and sure enough, she said, "Yep, you have fibro," and so I'm coping with that. But advocacy to me, I think I was also going to use the word voice. I think that's an incredibly important word. It is about using your voice in any way that you can to get what you need from who has the power to give that to you. So if it's, self-advocacy or self-care, sort of a sort of thing where you need to set a boundary with somebody to say, no, I don't have the energy to do that today, that's advocacy. Or if it's navigating the healthcare system to get the health care treatment that you need, or if it's going to Washington, D.C. to go to Capitol Hill and say, hey, we need this bill passed because it affects lupus. That's all advocacy, but it is fundamentally about using that voice that you have so that people can hear you. So that's what I got.
Liz, same spiel.
All right.
Yeah, same spiel.
I don't even know if I need this mic, but we'll see how it goes. I'm Liz Barroso. As Toby said, I'm licensed clinical social worker. I work here at UCLA. I was originally diagnosed with rheumatoid arthritis and lupus when I was 16, and I was too cool to get involved with any advocacy activities, too cool for school. So actually, my friends mainly and my family were the ones that opened up advocacy for me in terms of participating in walks, in doing kind of fun activities like a fundraising band, like Battle of the Bands and things like that actually really helped me process my disease as a teenager. It also helped me realize that I really wanted to be more involved in advocacy, and eventually it led me to being an advocate for others through social work. So advocacy to me means empowerment, and that's a very social worky word. So I Googled it, and empowerment is kind of around finding control. So finding some control when other things seem kind of out of control, which lupus can very often feel that way. And so I, like what Juana and Jessica were saying, feel that we can find control or feel empowered not only through our own self-care and our own advocacy, but also involvement in the community and at higher levels like government advocacy and clinical trials, or even just, posting things on Facebook or showing what lupus means and rheumatic diseases, what they look like in our community. So I do, as Toby was saying, I do support groups in Sherman Oaks and in UCLA, and I see a lot of people from those groups, and I love your faces. But I also see patients from our pediatric support group that we do at Children's Hospital, and I think that's extremely powerful because that shows that advocacy is across ages and across experiences. So I really just wanted to acknowledge that and thank those young adults for being here today.
That's great. So my first question is for Jessica, and we know that you spend a lot of time working with lupus patients, and we also know that lupus flares are super unpredictable. I mean, how many of you schedule lupus flares on your calendar? Probably not so much. Can you talk a little bit about what you teach your patients about planning ahead for a lupus flare?
Yeah. So I know it sounds really weird to say, like, plan ahead for a flare. You're not, like, planning for the actual flare. You're planning for how the flare impacts you in your life. Obviously not your body. It impacts you in all sorts of not very good ways physically, but it also impacts you in terms of your household. Do you have children? Do you have pets? You have to eat. Whoever lives with you has to eat. Your bills have to get paid. Whatever commitments you have outside of the household, those things are important. And when a flare hits, as you all know, those things all get turned upside down. So you've managed. You're here. You've managed. You've had flares. You've gone through them, and you figured it out. But it's important, I think, and we did this in support group a bunch of times where we thought about where are those areas that maybe we could think about ahead of time and put some things into place. So think about what can you do ahead of time, like who can you talk to ahead of time to say, okay, you know, I really need my dog to get walked or my kids need to get taken to school, and start thinking about those things and talking to people in your support network about those things, or make a list of bills that you have to pay, when are their due dates, which actually also helps with lupus fog because then you don't have to figure out when your bills have to get paid. You have a list. So planning ahead for a lupus flare, I could go and talk about it, but the general idea is basically brainstorm about all of those areas of your life and think about creative ways of what you can do to have a plan ahead of time, that when you're not feeling well, you can kind of call upon people in your life to say, okay, I'm not feeling well, I need your help to do X, Y, and Z. And you don't have to think about it when you're in a flare. You just have to call on those people. So that's
it's almost
general.
like it's almost like having like the earthquake preparation list. You know, if this happens, do this. If this happens, do that. Is that what you're suggesting?
Exactly, yes.
And how does someone sort of go about organizing all that? Because there are a lot of things. We all lead really busy lives. There are a lot of moving pieces. I know that when you're not cognitively feeling well, it can be extremely overwhelming.
So, I mean, what I've done and what a lot of people in my support group have done, and it could be different for you, but this is what we've done, is we've just taken a piece of paper and brainstormed what are those areas in your life. And you can do it with somebody. You can do it with your support group, which is really great because you have people who are in similar situations. You could involve somebody in your support network, like a spouse or a friend or a parent or something, and sit down and brainstorm those areas. And then brainstorm, okay, how are we going to address this when a flare hits? If you have a spouse who's like very, very involved in your life and very involved in the lupus community, then it's like way easier. But if you don't, then these are things that are important to think about.
So just to reiterate, because there are a lot of people who aren't married or single who maybe don't have the excessive or extended support network as others. Mm-hmm. Let's talk a little bit about what they can do and sort of ideas for them.
Sure. I think support group is kind of the key here. So there are a lot of people who don't have like extra money laying around to like hire a dog walker, right? Like, or just order takeout all the time, which is probably not very good for you anyway. So that comes up in support group all the time when I talk about this. Like, I don't have anyone to help me with my children. What am I going to do? And there's no clear-cut answer for something like that. The really great thing about support group is that the people who are there have probably been through something similar or maybe have some ideas, like they understand what you're going through. And on top of that, a lot of people, as you know, because you go to support group, a lot of you will become friends with each other. And so people in your support group become part of your network and say, oh, well, you should call me. And sometimes it's really hard when you're the one who needs help to say, I need help. So it's really good to talk about it so that maybe somebody else in your group could step in and say, I know you have a hard time asking for help, so I'm gonna offer you my help. So please, if you're in a flare, please call me. So there's no cut and dry answer, but I think the general answer is go to group, talk about it, maybe at a support group this should be a topic to talk about, and try to figure out how to address these things.
One of the things that we do at Lupus LA, I don't know, maybe some of you have had this or not had this, but certainly for newly diagnosed patients, when they come to Lupus LA, they're freaked out, they don't know what's happening, they don't know what to do. And we try to get people a Lupus Buddy who's a peer. So whether if they're a new mom or they're a young adult or they're a guy or whatever, we try to really start building that community for people because it's just so important. And even if you have lots of family and friends, having someone who understands lupus and who will understand, I'm not feeling well today, why are you not feeling well today, in a very sort of non-judgmental, empathetic way is priceless. So if you're looking for a Lupus Buddy, talk to Catherine. If you're not in a support group, go to a support group. If there's not one in your area, we're going to start one in your hood. Okay, we're going to move on. Juana, this is the next question. So you have this very awesome, close-knit support system in place. And well, this question's a little redundant because we just sort of talked about it. Mm-hmm. I'm going to skip this question because we don't have time for it. Because basically it just said go to a support group and get a Lupus Buddy. But here's my follow-up question for you. What if loved ones, friends, relatives, whatever, are scared and worried about lupus, that they're going to catch lupus? How do you as a lupus patient share information with others about lupus so that other people can also be informed, who then can turn around and be supportive?
I again encourage family members, not only lupus patients, to attend and learn about lupus, so that
Where would they go for that?
The support groups. Yeah, they can.
And the
Lupus LA website, and the Lupus LA website has very good information about understanding about lupus. And it's completely normal for our loved ones to also be scared for the lupus patient. Pretty much, I do encourage all lupus family members, friends, to join a support group. And obviously, check the Lupus LA website.
Well done.
Thank you.
And there's a ton of information, I would also say, on the web, not just at lupusla.org, but through the Lupus Foundation of America, through the Alliance for Lupus, or the Lupus Research Alliance, they just changed their name, as well as other local lupus organizations. And we, as an organization, are happy to also send newly diagnosed packets out to people with lots of information. And that's also where Catherine comes in to do one-on-one consultations with people, and not just patients, but also family members and friends. So, Liz, you're up. You ready?
Sure.
It's kind of like a game show. Oftentimes, lupus can be overwhelming and hard to manage. Can you talk a little? It can, yes, it can. Can you talk a little bit about what type of communication or advocacy is most helpful in a healthcare setting, and what's the best way to communicate effectively with your doctor? Because that's a tricky one.
Sure. So I kind of serve an interesting role in my life because I consider myself a patient professional. So I'm a patient with a chronic condition, but I'm also a professional within a health setting. So I see both sides, and that's good and bad. But The good thing about that is that I work so closely with medical providers that I can see kind of what their needs are and what their struggles are sometimes in trying to figure out what our patients need. And then my patient side comes through, saying, wait, but, from a patient perspective, this is what this looks like. And in my professional role, it's my job to meld those two together, but it's also helped me become a better patient, hopefully. I don't know if my doctor's here today, but she might say otherwise. Hopefully, in communicating the very best. We talk about this a lot in support groups. How do we get the information to our provider in a way that's going to be effective, get the message across, but also help us move forward with figuring out a treatment plan, with getting our needs met, and basically being heard. So what I always recommend is being concrete and as tangible as possible. How many of you guys hate the pain scale? Awful, right? Because I could say my pain is a 9. My husband could say a pain is a 9, and our pain's going to be really, really different. I've gone to the emergency room before with my husband or a loved one and said, my pain is a 4. And my husband says, why the hell did we come to UCLA emergency room for a 4 pain scale? So it's not that helpful. However, it is used sometimes in a medical setting. It's an example of something that is not really that tangible and not that personal. What I like to do is tell a story with my provider, because if I let her know what's changed from the last time I saw her in a very tangible way, it not only shows her whether I've gotten better or worse, but it also shows her how it's affecting my life. So for example, I like to do indoor cycling, like crazy indoor cycling. And I will be very specific. I'll say within 10 minutes, I had shortness of breath. Within 15 minutes, I had numbness in my foot. Within 40 minutes, I had to leave. The last time that I met with her, those times were different. So she can see very, very specifically what the difference is between the last time I saw her, and then figure out what we can do to solve that problem together.
So do you journal? So if you're at a cycling class, do you journal every day? How many of you journal, I'm feeling good today, I'm feeling crappy today, this is bothering me? Okay, everyone's hand should be up. It's really important for you to know that and for you to track that, because if you can't tell your doctor, since you put me on whatever medicine you put me on, I've noticed that every morning I wake up in pain, or I wake up with a fog, or whatever. And that's really important to do something that Liz is saying, because it's how you're going to get better treatment.
It also helps your doctor know what you do in your life. If you just say, I'm having pain, does that tell your physician about what's important in your life? Does that tell your physician about how it's affecting your activities of daily living, your hobbies, your interests, your family, your relationships, what you like and what you don't like? It's not really showing how your lupus is affecting your whole self. So I encourage you to kind of think of a story. Think of a way to communicate with your physician in a way that's going to help them know what you're experiencing, but also help them figure out how that's affecting your life in a good or bad way. I encourage you to, I use a thesaurus, because if I have pain could mean lots of different things. So I'll look up, I'm having sharp pain. What are some ways that I can describe sharp pain? So I'll look up, ways to describe pain online, and then I'll see different words that might better describe my pain, easier than just saying I'm having pain, because she's going to say, really great, let's move on. So I encourage you to be creative with your verbiage.
So I have a follow-up, which is, there are some times when people don't feel heard by their doctor, or their opinion and the doctor's opinion on course of treatment or what to do differ. How would you, as a healthcare patient professional, I like that term, I'm going to use that now, how would you suggest going about working with a doctor who maybe doesn't necessarily seem open to working with you?
Sure. that's where you need to speak up. I know it can feel very, very vulnerable talking with a physician, especially if you're not feeling well, especially if you're feeling like you're not able to communicate well. I know I've been, in the middle of a lupus fog trying to, tell a physician something, and I know it's not making sense. I know it's not what's in my head. What's coming out of my mouth is not what's in my head. Or what the physician is hearing is what they want to hear and not what I want them to hear. I encourage you, I think bringing someone with you is really important. Sometimes I'll ask my husband or a friend to come in with me so that they can maybe explain it in a different way or reinforce the misconnection between what I'm trying to say and what the provider's trying to say. But I also encourage you to get other people involved in the healthcare team. So that might be a nurse that you get along well with in the clinic. That might be somebody that took your blood that you felt like you connected well with. It might be a social worker that's in your clinic or from a community organization. It might be patient experience. Many, or if not all hospitals have a patient experience or patient relations department that their job is to make sure that your needs are being met in your healthcare. Don't be afraid to utilize those resources. That's why they're there. That's their job. They get paid to do that. I'm a social worker. I get paid to do that. I get paid to advocate for you. I wouldn't have become a social worker if I didn't want to do that. So ask your physician, ask the front desk, receptionist, anybody you feel comfortable with. If there's any kind of what we call ancillary services in your healthcare system that can help you advocate for your needs, but also just flat out tell your physician, this is not working.
And I would also say that, I had a follow-up question, but I'm not going to ask that one. I'm just going to say it. That, sometimes I know a lot of people feel that when they go to the doctor and the doctor says, you need to do this or you need to do that doctors are authoritative figures, and you're like, well, I have to do this. The doctor told me I had to do this. But if it doesn't feel right to you, it's okay to question it, and it's okay to get a second opinion or a third opinion. And really, you are in charge of your health. The doctor is not in charge of your health. You are in charge of your health, and you are in charge of creating the team that's going to work to best meet your needs for your health.
I like to let patients know that they're the experts. Mm-hmm. Your physician is an expert in the, really super hard to understand pieces of your illness, like the science in your illness. But you are the experts in what that looks like for you. So you have a role that is completely consistent with what their role is. It just looks different. So you're both experts in the room at the same time.
So this is my last question as we've been chatting.
Yes, sorry, I talked too much.
No, it's okay. You felt like 2 minutes. I'm going to give you 2 minutes, and then we're going to go talk to other people.
Please.
So sometimes I know personally, I can certainly talk on a personal level, and I know we get phone calls from patients all the time, like daily, that patients feel overwhelmed with all the insurance and financial issues that arise because of medical care that they need. So what are some ways to find solutions, and really what's the best way to connect with the supportive services at a healthcare facility?
Sure. So this is going to look really different depending on your healthcare facility. If you're having insurance issues, I would always start with the billing staff. Go right to the billing staff for that department. They're going to know the billing codes that were used. They're going to know exactly what was billed for you, why the insurance authorization is not going through. Many times it's not the clinic, it's the insurance that's causing the issue. However, the billing department can figure out ways to make that happen. If that doesn't work, there's always a larger structure over the billing department, like a general billing department within a hospital, that can further break down those charges or figure out how to navigate insurance. There's also community resources that are here to help you navigate your insurance. If you have Medi-Cal or any kind of public benefits, an organization that I love working with is called Maternal and Child Health Access. I can forward that information on to Toby. They're my partners in helping navigate any kind of Medi-Cal, Medicare, or Covered California insurance issue. and they will work with you to make sure that that works out okay. For private insurance, I always encourage patients to talk to an ombudsman. I can't even say that name right, but it's ombudsman. To talk with them. An ombudsman is a representative for patients that is a neutral party for the insurance company. So that's going to be the person that you want to talk to if you have private insurance or a Medicare supplement, or any kind of private insurance. There's also an awesome organization called Health Consumer Center, and they have programs across LA County and beyond that help with Medicare, Social Security, and navigating private insurance. So it's called Health Consumer Center, and if you Google it, all those things just come up. So that's both public and private benefits. If you have additional questions, I can stay after and answer more specific ones.
Okay, thanks.
Yeah.
You did that in less than 2 minutes.
All right.
So I'm going to walk around a little bit because I can't sit for a long period of time. And luckily I'm on this wireless mic, which is helpful. So Jessica, Lupus LA receives a lot of questions, and we work with a lot of people regarding work accommodations and disability. I know it's a very frustrating process for most people. I would love to share a few questions that we get asked often. And let's start with work accommodations. What should a lupus patient tell their employer, or should a lupus patient tell their employer that they have lupus?
Not necessarily. That information is your private medical information, and if there is a need for them to know, then okay. But if there's no need, if you go to work and you use your sick days to go to doctor's appointments or your time off or whatever, they don't notice, then there's no need to say, hey, I have lupus, I just want you to know. If you do want to tell them for any other reason other than accommodations, that is your own personal decision. It depends on your employment environment. If the office is super nice and everybody's really supportive, and maybe somebody else has a health condition and you've noticed that everybody is super kind to them about it. If you have a human resources department that is very private, that's good. But if it's a very tiny office where everybody knows everybody's business and you don't want them to know your business, then you might not want to tell them. So it's very, very individual. But in terms of an accommodation, wait, what was the second part of the question? I started going off and I forgot.
My second question is, what is a work accommodation,
Okay.
and how do I get that, and do I need it? And
Okay, so then I'll talk about that.
Stuff.
So work
and how do you
accommodation.
even request that?
Okay, work accommodation is some accommodation, something that you need in order to do your job, something that you need because of lupus in order to do your job. So maybe because you experience fatigue a lot, you need maybe days working from home. Maybe because you have to go to the doctor a lot, you need them to be more flexible with your scheduling, things like that. If you have mobility issues, you want to make sure, obviously, that the building has an elevator so that you don't have to climb the stairs. That's usually by law, they have to do that. To request an accommodation, you would need to disclose. If you have a human resources department at work, you can talk to the human resources department, ask them what they need. They'll probably give you some, they might ask you for a letter from your doctor or something like that, and you can talk to them about how specific that you need to be. And the accommodation has to be reasonable. You can't, if you're a teacher, for example, you can't say, I want to work from home. You have to be in school. But if it's something like they're asking you to lift heavy things and you can't do that and it's really not necessary, then that's okay. If there's fluorescent lights and you want to put light shields on the lights so that it doesn't trigger a flare, if that's something that triggers a flare, then you can ask for that. A resource that you should look up with anything having to do with accommodations is the Job Accommodations Network. Their website is askjan.org. And if you Google Ask Jan and lupus, you'll see a list of all sorts of different things that people with lupus have asked in terms of accommodations. So you don't go to work and then automatically need an accommodation. This is very specific to you, and people are often reluctant to ask for them. But if you really need it, ask for it. If your employer has more than 15 people, then by law they have to give you the accommodation, and like I said, as long as that's reasonable.
Great. how do you know, or how does someone know if they need a work accommodation versus, I'm going to walk this way because I see maybe some hands with some, don't forget your index cards. I'll take one, thanks. How would someone know if they need a work accommodation versus it's time to apply for disability?
So, I mean, theoretically, you want to try the work accommodation first, but lupus isn't always like linear, right? You don't just feel okay and then feel a little bit less okay and then feel horrible and can't work. So, but theoretically, if you can kind of make it in that direction where you're working and you're like, hey, I need this accommodation, but then you have the accommodations and you're just like, I can't make it to work. Even when I work from home, I can't make it to work on those days that I don't work from home, or it's just too difficult. If you're noticing that you just can't go to work, or you're at work but you're not like thinking as clearly, you're not able to get your work done, then it's time to speak to your doctor. And it's very, very important that your rheumatologist and you are on the same page about whether or not they feel that you can work. So have that conversation with your doctor, and then they'll give you their opinion. Like, well, I think maybe we should try this treatment, or let's see if we can, treat this symptom, see if it gets better. Or if they say, no, you know what, I think it's really a good idea for you to stop working. And stopping work doesn't have to be forever. It might be a temporary thing. Maybe like you need 6 months to go on this treatment, or you need to have hip surgery and you need time off. So definitely speak with your doctor, and also utilize that job accommodation network to ask them any questions that you have about accommodations.
So thank you for that. So again, what she was talking about is something called short-term disability versus long-term disability. So whether it's short-term, like a 6-month, versus forever or longer. So Juan, I'd love to ask you a question. And for those people who are in the room who haven't yet been to a support group, what can you expect when you go to a support group? Because it's always a little nerve-wracking going to a group of new people who you don't know, and then people want to share things, but you may not have to share anything. It's sort of up to you.
Okay. Well, there's different support groups. With Lupus LA, there's 9 support groups, and they're all facilitated by different people, and we all do them differently. In the support group that we run, we actually have it both English and Spanish, and we're there. We share. The group. Oh God.
You do crafts, right?
Yeah, we do crafts. We do adult coloring. We do mindfulness, and we do art therapy. So our support group is just involving everybody, and just sharing with one another and help each other support.
Do people have to talk if they want to?
They don't have to talk if they don't want to, but as long as they're there and learn from others, then that's a great game.
At each support group, and Liz, actually all 3 of you can answer, do you share at the beginning that the groups are confidential?
Oh, we do. And all all support groups are confidential. We do not share. In our support group, there has been times where we do ask, if we can talk about it, but within the group. We don't go outside the group and talk about what we've discussed.
And so I know that they happen monthly. People's lives are busy. Do people have to commit to going every month, or can they sort of drop in and drop out and come in? And
well, it's not a mandatory where you have to be attending once a month, but it would be recommended just to have that bond with the group and learn. Yeah, but no, they don't have to. They don't have to be attending the same group, or if they don't feel comfortable in a support group, they can always go to the other support groups.
So I'm going to just open this up to the 3 of you, because we spent some time talking about advocating for yourself, about self-care. Do you think, and I get this question all the time, where people are like, yeah, advocacy, does it really work? What does it do? Like, can you really make a difference? What do you guys think?
Yes. That's why we have this panel, right?
Obviously, we think so.
Yeah.
But in what ways? Like, can you elaborate on that other than yes?
I think advocacy can be really scary. It's like a scary word. How many people are sort of scared when they hear advocacy? Oh, okay, never mind.
Maybe they're scared to raise their hands.
Yeah, okay, yeah, true. So advocacy can be really scary, but what I like to do is break it down. So advocacy can be anything from posting something on Instagram or Facebook to sharing your experience with somebody in like the deli counter to the legislative action and involvement in clinical trials and everything in between. So advocacy is about ways to empower yourself in our community, but there's an entire continuum of what that looks like. And we rely on you guys to find where on the continuum you feel most comfortable participating in advocacy. And, obviously you don't have to, but it's a way that we can, advocate for our needs, but also get our community more involved so that we can have more resources, so that we can have more medications that are available with less side effects. I think that the pros outweigh the cons, and the more people that participate, even on smaller levels that we might not think of as advocacy, it's still getting the word out and having people ask questions and prompting interest, which is what we're looking for ultimately.
If your voice isn't heard, then no one's going to hear you. So if that's with federal legislation for healthcare policy, whether it's about, medication being available through your health insurance, if it's about your doctor hearing you, there's an article that you can Google. It's called the good patient syndrome. And advocacy is about communication, no matter what you say, however you cut it or whatever the saying is. Because it's about using your voice. Who are you communicating? How are you communicating? So the good patient syndrome is if I'm really nice to my doctor is going to do everything for me and just be like the best doctor ever. And because people are afraid to because the flip side of that is if I'm not so nice to my doctor, they're not going to give me the same treatment, or they're not going to give me the best treatment. I'm not saying to yell at your doctor or be nasty to your doctor, but you don't need to be extremely timid or smiling at everything that they say, thinking, well, if they like me more, then and everything will be okay. So the good patient syndrome has to do with somebody with cancer who did that, and things didn't work out so well, and then she realized, oh my gosh, I need to use my voice. I need to say what I need because my doctor isn't going to know that this is not what I need, or this is not what I want, or this is not what's working out for me. So when you do that, yes, advocacy works, right? And yes, advocacy works when people advocate for, I keep saying, policies and funding, because we wouldn't have what we have today for lupus, whether it's research or access to health care, if those things didn't work. So that's all I got.
Wow, this is really long. Okay. Sorry, I now need to go to the next card. So I wanted to say, as far as advocacy goes, which I'm hoping that you're hearing, a lot of times people are saying, oh, it takes too much time. Oh, I don't have money to donate. It doesn't take any time, and it requires no money. Really, an Instagram post, a sharing. I was at Cantor's Deli this morning at 5:30 because I was hungry and on my way here. And wound up having breakfast with this guy who I'd never met before, an older gentleman. And we spent a lot of time talking about healthcare policy. And I was trying to explain how, while healthcare policy is not perfect, the number of people who now have healthcare, especially lupus patients, which is what I care about because I run a lupus organization, is dramatic. And having access to care in general is really important. Now, perhaps the gentleman was not in agreement with me, and we had a very interesting breakfast, and we shook hands and went our separate ways. But it really, it cost me my $7 breakfast, which I was going to eat anyway. So it really, there's kind of no excuse to advocate not only for yourself but also for others in a community about something that you feel passionate about, whether that's something that directly affects you, like, lupus, or whatever other issue if you really care about animals or the environment or whatever. Okay, let's move on. So the last discussion topic for this session, then we're going to get to these questions, is other ways also to get involved in doing advocacy on a local level. And Juana is awesome at this. Juana and her sister and members of her group, and actually members of a lot of our support group throughout Southern California, go and get proclamations at their local governments for Lupus Awareness Month. And it's such an awesome thing to do, and I could talk about it forever, but I'm going to let Juana talk about her experience, about how to go do it, why it's important to do it, and what she gets out of the experience.
Well, proclamation is you actually go to your city council and let them know, especially for May, as being Lupus Awareness Month. What we have done is done the proclamations, asked for the proclamation. We do have a chance to, during a city council meeting, to present and talk about what lupus is and why it's so important for advocacy and to share about lupus. Out of the proclamations that we have done, we have received so much response. We have had people who have talked to me, have contacted my sister, and they have asked how they can get the help. We are very happy to say that it has helped us reach out to those who don't know about lupus and who need the support. We have actually asked for about 7 proclamations in different cities, Baldwin Park being one, La Puente, Azusa, Glendora, and on some of the cities we don't have to go present, but on most of the cities we do go and present about lupus.
Yeah, which is actually really great. I did Beverly Hills this year. I went and spoke, and they actually record all of their meetings and put them on TV, so you can even download and watch me do my little spiel on lupus. But it's such a great way to teach communities about lupus. And then what we do is we collect all of the proclamations. Actually, I think there's one out on the table. Yeah. And we post them all through the month of May, which is Lupus Awareness Month. And it's just a really good thing to do. We've gotten actually grants from, we get a grant from the city of Irvine every year when we do the proclamation, which helps do some kind of special activity with our support group, the Orange County support group. Last year they had the art therapist come in? And then what did they do the year before? Yoga. They had a yoga therapist come in. So it's a really cool way to also get involved in your community, get awareness for lupus, as well as sometimes also getting something back. So we're going to go to some questions. Ladies, thank you so much. That was awesome. If you have questions, I'm gonna do this aisle, and Catherine's gonna do that aisle. Or that's not what I just said. I said I was gonna do that aisle. Sorry about that. And we're gonna try to get to as many as we can. And if you have other questions, always please hand the cards to us, and we'll look at them and hopefully write your email address on it also. Okay. This is a good one. Okay. How do I figure out the most effective billing codes for blood work? It radically affects insurance reimbursement rates.
Okay,
who wants to answer that?
Billing codes?
Basically, how do I figure out the right billing codes? Because depending on what the billing code is, it depends on the rates. So It's not just blood work, it's whatever.
Sure. So your reimbursement, so your coverage of your insurance is based on billing codes. So when your doctor sees you and takes blood, there's a billing code for that blood work. When a doctor does an MRI, there's a billing code for that service. So every service that a physician or a hospital does has its own billing code. Some hospitals and some providers are better than others at knowing the appropriate billing codes. Usually, depending on your insurance, there is a billing code on the information that they send to your home where it says this is not a bill. However, not all insurances do that. So if you feel like there is an incorrect, any kind of incorrect billing, like you feel like it's too much or you're not sure why you got a certain bill, when you talk to the billing staff, you want to specifically ask them if they used the correct billing code for the service that you received. And what I do is I Google that billing code, and I literally just copy and paste it into Google, and it will show you exactly what that service is. You don't even have to put billing code. It usually just comes up right away. And then you can say, oh, I got this service, I didn't get this service. And if you feel as though it was something that was billed incorrectly, then you can always contact your provider, or you can talk to the billing staff for that department, or the physician medical group, depending on who billed that for you, and make sure, and let them know your concerns that you feel that an incorrect billing code was used. But it's really hard to navigate that. They're really, we have to be careful about things like fraud, or we can't really tell somebody, oh, you used the wrong billing code, I want a cheaper billing code. They need to bill for the services that they used. But if you feel as though that wasn't the service that corresponds with that billing code, that's absolutely something to speak up about and let them know that you either did or did not receive that service, so that they can talk more with you about why they used that coding.
Oh, that's a good one. You guys are giving great questions. Okay, so the doctor suggests a medication to try, but healthcare denies, and request based on age feels not needed. How do I push for approval? And when I know it might help, do I keep appealing? So I'm going to answer this question, because funny enough, I just spoke about this question at a CPAC conference, which is, it's called step therapy. So what happened? Oh, you keep giving me new things. Oh, that's a good one too. Okay. So what happens is that insurance companies have protocols that they want doctors to follow. Like, let's say, I don't know, you have lupus, and they want you first to try Plaquenil, or they want you first to try prednisone, or they want you first to try whatever. They're not going to give you Benlysta. They want you to try everything but Benlysta, because Benlysta is super expensive. But you really want to try, you're like, your doctor is agreeing, and you agree that you need to try Benlysta. Is there a way to fight the system? So the answer is yes and no. Mm-hmm. So a lot of times it's going to take a little time. Will you eventually get Benlysta? Probably. Not always, but probably. And you really have to make sure that if you do get denied for a treatment plan, that your doctor is on board to help you fight it. Because you're not going to be able to fight it alone, and your doctor probably isn't going to be able to fight it alone, because your doctor sees hundreds of patients. You have to decide to be a team about it, which means that you have to, what will happen is, the doctor will send a prescription in, the prescription will be denied, or you need to get a pre-approval from your insurance company for something. The insurance company says, no, we want you to try Plaquenil first. And you're like, I don't want to try Plaquenil, I want Benlysta. Mm-hmm. So what happens is the doctor can then go and try to get that. They have to fill out paperwork. They have to help be your advocate. You can certainly also call your insurance company. What they're probably going to say is, or what normally happens is, you're going to have to probably try whatever they want you to try for a few weeks, up to a month. And it's going to delay you getting the treatment. Now, this is the silly thing about step therapy, is because it's delaying giving you the treatment, you probably are going to get a flare because you're not getting the treatment. And then if you get a flare, you might have to go to the emergency room or the hospital. So it's a little backwards in the thinking, because it actually turns out to be way more expensive by not giving you the medicine that you and your doctor think that you should have up front, and the hassle factor and the stress factor. And you all know that stress is not good for lupus. So all in all, it's a very hard process. The person who wrote this question, if you feel like sharing, have you tried to appeal it? You shared it back there. Have you tried to appeal it?
Yeah, actually, I've had situations where a doctor will prescribe a certain medication, they will actually haven't tried something before this
Your doctor actually can help you advocate for that. So you should really be working with your doctor's office. And also, we as Lupus LA have gotten involved in that process as well. You know, we do a ton of things: doctor referrals. We help people with healthcare navigation. So there are resources, and some of the organizations that Liz talked about. There are tons of organizations out there who are there to help you. You have to just be a little bit resourceful and patient. And sometimes when you're not feeling well, being patient, it's not an option. Is this a follow-up question to that one?
No, I just wanted to share something that's worked for me.
Sure.
Which was contacting the drug companies.
Yep. So I'm gonna. Yes, thank you. I'm gonna repeat that. So what she said is sometimes what helps is contacting the drug company directly. That is absolutely true. You know, a lot of times these medications are also super expensive. There are copay plans. They want you on the drug. Like, drug companies want you on the drug because that's how they make money, right? It's not in their best interest to not help you get the drug. That's a great suggestion. Thank you so much. There was a question back there and a question over there, and then we're going to go back to the cards.
I just wanted to follow up with the young lady here that I'm going through the exact same thing, and I have an awesome doctor here at UCLA
Who's your doctor?
Dr. Jennifer Grossman.
Woo! We love Dr. Jennifer Grossman. She presented here last year or 2 years ago. Yeah.
She did. I'm here every year. So at any rate, she's advocating these. She's done the appeals. They're still denying it. They're saying that their doctors on staff have made a determination that I don't need the drug that she's recommending, and we're both like pulling our hair out. And of course,
Honestly,
so how do we
send a legal letter.
do what?
Send a legal letter. Send a letter on lawyer. Have a lawyer send a letter, and I bet you that's going to turn around a lot faster.
Oh my gosh.
And I am not in favor of that, but it can and has worked in the past. But if you really find that you're at a tipping point and your company is not going to give it to you, and you've called the drug company and you've exhausted everything else, there are other options. I said this woman right over here. Yes.
I wanted to add to this conversation if I could, because I have another kind of a rare disease where I've had to do an awful lot of advocacy for myself in order to get the medication and treatment that I've had. Most insurance companies somewhere on the internet post the criteria that you need to meet in order to have a particular medication. I have found that it's really, really, really important for us to know that information. Make sure that our doctors know that information. Make sure that if our insurances deny us, that there is an appeal which addresses their criteria. And if it's rejected at that point, to insist that your doctor does a peer-to-peer conversation with the insurance company after that, the lawyer letter.
Yeah.
Sorry,
I missed that part.
It's really important to know the criteria of your insurance company, and if they aren't going to support your disease, change insurance.
So did everyone hear that? Because that was super important. Did anyone not hear that? You didn't hear that? Basically what she's saying is all insurance companies have the criteria for specific drugs on their website somewhere, and to know what that is very important to make sure that the doctor is sharing that that's the criteria. And then if they're still not willing to approve that drug, ask for a peer-to-peer conversation between the doctor and the doctor of the insurance company. And then you move on up on the ladder after that. Okay, I'd like to move on up there. Okay, last. Go ahead, Sydney. What do you got?
I've been told by my insurance company that they don't have to release that.
They don't have to
That's
release
illegal.
what to? That's illegal.
What about
You mean the criteria for? You mean that they're not required to release the criteria for?
schedules and pricing? I have so oftentimes I just have a copay for different treatments and tests, and I've been told that they don't have to release that to me.
The pricing or the criteria?
The pricing.
The pricing, they may not have to, but it's illegal for them not to post the exact criteria for assessment of an approval of medication on the website that's public. So
Okay.
pricing might be a little sketchier area, but definitely the criteria. What I do is I download the document and press Control F, find, put lupus or the medication, and then copy and paste it and put it in the letter that we do to appeals.
All right, I'm going to move on. Can you ask me after, Dina? Or ask Liz after? Liz is later. Yes, Liz will
I'll be
here.
around after. I can answer.
Okay, go ahead. What do you got? This is the problem when I know your names. Okay, go ahead. You need to just speak up. Generic drugs, what about it?
A lot of doctors feel that brand and generic are not the same.
Mm-hmm.
And as we know with the EpiPen situation that just came out, what is the difference? Why does the generic have something different or something left out of it, and it goes down by $300 or $400? That makes you question the first thing. And I think a lot of this is very political.
Sure. Oh, duh.
Second
Yeah.
of all, if there is a generic, insurance companies will only pay for the generic.
Sure.
But a lot of doctors feel that the brand is
Correct.
different than generic. From personal experience, a lot of people feel, and I don't think it's just psychological,
Sure.
a lot of people feel that there's something in the brand versus the generic that does work better for them.
Yeah, and that's going to be dependent on different drugs. So some medications, the generic and the brand might not have a problem. Other times it's dependent on the patient. So a physician might say, I think for you, a brand would work better than a generic. That's going to be the same appeals process that you would do for any denial of a medication. Even if they're approving the generic but not the brand, if your physician is advocating for the brand, they need to very, very specifically outline what the criteria is, why they're recommending the brand over the generic. They need to be very, very specific about that. So whether it's an allergic reaction, whether it's an increase in the percentage of how effective it might be, they need to be very concrete about that criteria. But it'd be the same appeals process.
So,
Dispense as written, which tells the pharmacist.
but it can't be the generic.
It just doesn't mean insurance is going to cover it.
The thing is, it's one more thing.
Sure.
So I'm gonna switch the conversation a little bit because I love this question that we got. How do you cope with quote unquote "you don't look sick"?
What does sick look like?
That's where advocacy comes in, right? Education, awareness about lupus. How do you cope on an individual level when you're upset and annoyed and irritated? That's a different thing. I mean, how do you respond to the person versus how do you cope are two separate things. So how do you respond? You might want to get angry, right? But that's probably not so effective. So you might want to think in your head ahead of time, like if somebody says something like that to me, am I just going to be quiet about it? Am I going to say something? What am I going to say? But it's definitely something that I am sure everybody who has been to support group has spoken about, and that is a very, very, very good thing to speak about at support group and find out how other people cope with that and how other people respond to that.
How do you guys respond to that? What do you say?
Yeah.
Like, can some of you share? Like, what do you say when you're like, "Yeah, you don't look sick"? Hi.
My thing is about that is
Here, give me that.
power. And you have the power to determine whether you're sick or not. And also, you don't have to explain to people why you don't look sick. Okay? Why would you get upset about it? I mean, this is something that you have to control yourself. And when people tell you, "Oh, I don't look sick," why am I getting mad? It's none of your business whether I look sick or not. I have a disability that causes me not to be able to do the things that most people can do or normal people can do who do not have a disability or disease or illness.
That's right. I love that answer. Then okay, we're gonna take a couple people over here. You want to go first? All right. How do you cope with people telling you you don't look sick?
You can have cancer and it doesn't show.
Absolutely.
You can have diabetes and it doesn't show. You can have all kinds of illnesses that don't show. And I think the reason that question's important is that people in your workplace and in your family and neighborhood and friends need to understand from you, I have an illness. I take 14 pills every day. I can't work, whatever it is. But it doesn't mean because I've got my hair and makeup on that I'm not sick. I am sick. And I'd appreciate it if you'd respect that from me.
And you look really good, sir. Last comment, and we're going to move on because I want to get one more question.
That was so great. Slightly on a tangent, I had an accident that I was very public about, and I had a really big surgery and wore a neck collar for a long time. And people still, 4 years later, ask, so how are you? And they want details. And I decided to say, well, I'm in my new normal. And it gives people kind of assurance to them and a friendly response, but we're done. Thank you.
Yeah. One-liner. All right, one-liner.
Thank you very much. It means a lot to me. Thank you for the compliment.
I like that. Yeah, that works. Yeah. I'm going to try that one. Because normally I just get really frustrated, like, what are you talking about? So there are some really great questions or comments that are on these cards, and I'm going to make sure that we share them, and I want to make sure that we have time for lunch. So I want to thank Juana and Jessica and Liz for their time today and their expertise. I don't need both mics. Okay. The last thing I'm going to share, and then we're going to break for lunch, and you'll have 40 minutes for lunch, so you have to be back in your seats at 12:40. Please, not 12:45, 12:40, because we want to make sure that we have enough time for the rest of the day. There are a couple of questions about journaling. So journaling can be done in so many different ways. There's someone who wrote down a couple of apps that work. I do it on my phone. I actually do it in my calendar. And I just I have like a little color code of I feel good, I feel bad, or this happened or this happened. So that when I go to the doctor, I print out all of those codes, and I'm like, this is my last 3 months. Or if I'm having a flare or whatever it is that I'm having. It's really important to keep track. There are a ton of journaling options online. Whatever works for you. Handwriting doesn't work for me because it hurts to write sometimes. But typing feels better. So whatever works for you, you're going to have to sort of figure that out. But it's really important. You can please take your stuff with you, or if you want to leave your folder, but please take your bags. Don't leave any personal items in here. Take them with you. Lunch is out there. I think that there are 2 buffets. They're both double-sided. I would like you to be mindful that please take 1 portion of things, and then if there's more, you're welcome for seconds and thirds and fourths and fifths. I'll see you in 40 minutes.
I take it as a compliment you're sharing sweat with me.
Well, you do understand
everything and everyone.
You are one